question, what do you think is the reason for the hotspots that we have seen? Why is one place breaking out and another place seems to be lower than expected? Wisconsin, for example, most parts of Wisconsin are lower than were predicted about 3 weeks ago, whereas New York City is still appears to be, the epidemic still appears to be growing in New York City, even under extreme lockdown conditions. So anybody want to field that one?
I'm not sure I have a great answer. I'd love to hear some of your thoughts on variation in the US, but one thing that my research group looked at initially when things were getting so bad in Italy was trying to understand, what might be the reason for that. And Italy is actually one of the oldest countries in the world. It has over 23% of its population over age 65. And we've seen that a lot of fatalities are concentrated at these older ages. So we thought that was one reason that we saw a lot of deaths there. But actually in combination with the fact that there's a lot of multi-generational families in contact in Italy, between younger people working in Milan and then living out in the villages or commuting back and forth. And so one thing I think that's been interesting about New York City is that it's not the most dense areas like Manhattan that have been hardest hit. It's been more immigrant communities. And I think there very well could be something with these high levels of intergenerational contact that help spread the infection from more asymptomatic or mild cases to these more vulnerable populations. And so I think that's one thing that seems to make sense there. But I think it might make sense to kind of look at how these demographic things vary across the country and even local areas to see what might be vulnerable areas for hotspots.
And Amanda, do you think you can, do you have any comment on why some places are doing better than we predicted them to do, say 2 or 3 weeks ago?
Social distancing. Yeah, I mean, I think that's a highly that's a possibility, and I think it's a testament to the success of social distancing, right? So some of the recommendations around social distancing are that you don't travel to other parts of your state. You don't go to your vacation home. So I'm in, Malia and I are in Wisconsin, and that was one of the recommendations by the governor. And so in those more remote areas, if we've had less people visiting, then there's less opportunity for transmission to areas that are more rural, that the population's not as dense. And for many of those areas, those are, towns where the average age is older. And so we do want to protect those populations who also have fewer hospitals and other, resources from that infection. So I do think in part that is a success of social distancing.
And I also, in addition to social distancing, I want to give a plug for good old fashioned public health. So I'm going to tell a story. Here in New Hampshire, Grafton County, that's where Dartmouth and its environs are located, we had one of the first confirmed cases in the country. And it was somebody who had returned from Italy, had contracted the virus, had unfortunately been told to quarantine and didn't, and instead went to a social event for the Tuck School of Business, which is my employer. And this was cause for a lot of alarm and panic. But I have to say, our public health department blocked and tackled. So this whole test, treat, isolate, right? Test, trace, isolate, it works. And I know that there's a similar situation, in other places too, right? So like ours has been reported in the newspaper, so I'm not sort of like speaking out of school or anything. This is very well known. So I think this is why people like us, we sound like broken records, we sound like scolds because we won't stop talking about testing. And I'll tell you why I won't stop talking about testing. It's because Dartmouth has not had an explosion of COVID, even though we had one of the earliest cases because there was a test.